Mr. Speaker, I wasn't here when the Affordable Care Act was passed. I was in the state legislature in Virginia. It was after I had become a mother. It was while I was part of the sandwich generation, trying to raise 2 children and deal with elderly parents nearing the end of their lives. It was while I spent a lot of time trying to figure out how we were going to close the insurance gap so that no one would face a couple of scenarios that I was lucky enough to have health insurance to cover, but a lot of people don't. The first was when my son was about almost 3 years old, and in the blink of an eye, grabbed my curling iron and burned his hand. We were in a rural community in Virginia whose hospital didn't have a burn unit. It was very small. They couldn't even figure out what degree the burn was. This was on a Saturday. And they said, you can either go home, and on Wednesday there's a burn clinic where they can look at his hand for free, or we can see if VCU Health Center can admit him today. I said, well, he's going to get admitted today because I knew I had health insurance. And whatever that bill was going to be, I didn't have to worry about it. If I didn't have health insurance, I would have been forced to wait until Wednesday to go to the clinic, and his hand probably would have been infected. So after a 3-hour ambulance ride, a week in the burn unit, all the medication, the bill was $15,000. In the blink of an eye, my son's injury cost $15,000. But I was lucky because I had health insurance. So I only had to pay $1,000. I was lucky I had the ability to pay that. At the time, we were trying to figure out, should Virginia expand Medicaid to help people who can't afford health insurance get it. And we were able to expand it on a bipartisan basis because in our rural areas, they understood Medicaid expansion was critical to keeping their hospitals open. And over 300,000 Virginians got health insurance because of that. Now, those 300,000 Virginians face the prospect of losing their health insurance because of actions Congress took in July with the largest Medicaid cut in American history. In our rural areas, 6 hospitals in Virginia are at risk of closing because of those Medicaid cuts. One in my district that's a healthcare safety net, that the closest hospital, if they close, is over an hour away. We also created our own state-based healthcare exchange, and 573,000 Virginians signed up. And many of them now face the prospect they won't be able to afford their premiums when their tax credits expire in 17 days. This is all in the context of folks seeing their housing costs increase, whether it's rent or mortgage, their energy bills increase, childcare increase. A lot of folks are facing the prospect that they cannot pay their rent and for their health insurance. So they're playing the lottery, figuratively. The lottery that they won't get sick, the lottery they won't get injured. But when they do, whether they're insured or not, they're showing up at the hospital, and the rest of us will pay the cost. Mr. Speaker, as we enter the holiday season, as a preacher's kid, I've been thinking a lot about Matthew 25, verses 31-40, where Jesus said, "Come, you who are blessed by my Father." He said when he enters into his kingdom, all the nations will come, and he will say, "Come, who are blessed by my Father, take your inheritance, the kingdom prepared for you since the creation of the world. For I was hungry, and you gave me food. I was thirsty, and you gave me something to drink. I was a stranger, and you invited me in. I needed clothes, and you clothed me. I was sick, and you looked after me. I was in prison, and you came to visit me." And the righteous will answer him, "Lord, when did we see you hungry and feed you, or thirsty and give you something to drink? When did we see you a stranger and invite you in, or needing clothes and clothe you? When did we see you sick? When did we do this?" And he said, "What you did for the least of these, you did for me." And I came to Congress looking to do for the least of these as well as every American. But Congress's priorities this year have not been that. Congress bent over backwards, congressional Republicans specifically, bent over backwards to provide permanent tax breaks for people who make over $500,000 a year. But if you make $64,000 a year or a family of four that makes $129,000 a year, you are just expected to absorb health insurance premiums that double or triple. If you make $21,597 a year, or a family of four who makes $44,000 to $45,000 a year, you are supposed to absorb your health care costs if you lose access to Medicaid. That's upside down. And what we're saying is, to the least of these, you're on your own. They deserve better. They deserve better. We have 4 days to try to prevent millions of Americans from losing access to health insurance. Are we going to do it? Time will tell. I still have hope, but we'll see. Mr. Speaker, I yield back.